Hey everyone. It's a couple minutes after the hour, so I think we're going to get started. So welcome. We want to welcome you to today's webinar entitled The Advancing Healthy Lifestyles Initiative, Workplace and Employee Wellness. We're very glad that you could join us today. I'm Dan Finkelstein from Mathematica, and I'll be presenting to you today on the Advancing Healthy Lifestyles Initiative. This webinar will present on the overall mission and strategy of this initiative, the national and local context for this work, and finally, the part of the initiative that focuses on workplace and employee wellness. Advancing Healthy Lifestyles is supported by the Physical Activity, Nutrition, and Obesity Prevention Program, or PANO, which is part of the State of Delaware's Division of Public Health, Bureau of Health Promotion. So let's start by going over a little housekeeping for today's webinar. First, to avoid background noise, everyone has been muted upon entry, but we can unmute folks for specific questions at the end. Next, all webinar participants are on audio, and only the presenters, like myself, will be on video. Third, we will take questions at the end, and you should feel free to submit any questions or comments that you have. To ask a question, just use the chat window as shown in the figure to the right, and the chat window itself will be in the bottom right corner of your screen. Fourth, we'll be recording the meeting and disseminating it after today. And when we circulate it, you should feel free to share it with your colleagues. We'd love to have folks who aren't here today have a chance to hear what we have to say. Finally, if you're having any technical issues, please send the event producer a private message through the chat function. And with that, let's begin. We basically have three goals for today's webinar. We want to describe the burden of chronic disease risk among Delaware residents, as well as the impact of COVID-19 pandemic. We want to highlight the PANO program strategy, which is to support organizations in promoting healthy lifestyles in communities, schools, and workplaces. And finally, we want to introduce the Advancing Healthy Lifestyles Initiative to you, including describing the work that is currently underway within the state. So before we get into the content of today's webinar, we're going to start out with an icebreaker just to understand who is present in our virtual community audience today. To do this, we're going to include a poll in the webinar that asks two questions. The first will ask you about the type of agency or organization where you work, and the second will ask you about your familiarity with PANO's work and activities. So Derek, can you please begin the poll for us? Great. We're going to give you about 30 seconds to answer each question. And just as you can probably see on the screen, but I'll just read it for you. The first question is, how would you describe the type of agency or organization where you work? It could be state government, local government, community-based organization, higher ed, primary or secondary ed, health consulting, or another category, and you can choose one. Okay, great. So in looking at the results on the screen, we see that a lot of our audience is representing state government, comes from a state government agency, about half of the audience. Another quarter are coming from community-based organizations. And then we have a couple folks who are coming from an other category. So great, thanks for telling us a little bit about yourself. Next, we want to ask our second question, which we'll put on the screen. And it says, how familiar are you with PANO's work and activities? And you should rate your familiarity from not familiar at all, somewhat familiar, or very familiar. All right, and with that information, we see there's some familiarity with what the work that PANO is doing. About 20% said they're very familiar, and close to half said they're somewhat familiar. And about a third of our audience today doesn't know a lot about PANO's work and activities. So we relish this opportunity to tell everyone a little bit more about PANO and the work of the Advancing Healthy Lifestyle Initiative. So now let's look at the mission of the PANO program. The program's mission is to provide goals and strategies for a range of stakeholders focused on decreasing overweight and obesity in Delaware, including government, media, communities, healthcare providers, schools, and work sites. The three focus areas for the PANO program are physical activity, healthy eating, and obesity prevention. PANO addresses these three areas by trying to create healthier people, communities, and environments across the state of Delaware. The PANO's program strategy is to create healthier individuals and communities across multiple initiatives. The PANO program does this by building capacity to implement policy, programmatic, and environmental changes that address the four targets that are shown in this figure on the slide, which are healthy and safe community environments, clinical and community preventive services, empowered people, and elimination of health disparities. A key priority for this work to promote population health and prevent obesity is advancing health equity. To do this, PANO has structured its work and programming so it's targeted towards populations that are most vulnerable. It's delivered in an equitable way, able to be sustained for the longer term, and will yield improved long-term health impacts in the state. As you probably know, strategies for advancing health equity don't just focus on individual lifestyles and behaviors, but they also address the broader environment that influences these behaviors. This includes the social determinants of health that are displayed in this picture on the slide. And the social determinants consist of economic stability, education access and quality, access to health services, the neighborhood environment, and the social and community context. And while the PANO program does not address all of these social determinants of health, its activities strive to address the factors within the social and community context that influence overweight and obesity risk and other chronic disease risk factors. So as we'll discuss more in this webinar, the social determinants of health can have a profound influence on the risk of overweight and obesity. And these social determinants have also played a significant role in the COVID-19 pandemic, with individuals of lower socioeconomic status and racial ethnic minorities working in essential jobs that put them at higher risk for exposure and infection. In addition, COVID-19 restrictions themselves have exacerbated the risk of obesity, for example, by increasing economic stability and food insecurity and limiting opportunities for physical activity. In these next slides, we present the state and national context for PANO's work. We look at data on obesity and chronic diseases within the U.S. as a whole and the population within Delaware. These data make the case for the Advancing Healthy Lifestyles Initiative's strong focus on advancing health equity. So how healthy is Delaware relative to other states in the U.S.? In general, Delaware is a little below average on health indicators related to health and obesity. Recent data from 2019 show that Delaware is just below the national average on indicators related to healthy nutrition and physical activity, and in the bottom half on obesity prevalence and rates of preventable hospitalizations. Now, as this map shows, obesity, which is the O in PANO, continues to be a national health concern. The prevalence of obesity is high across the U.S. and has been increasing steadily over the past 40 years. This trend is detrimental to health, as we know that obesity is associated with several chronic conditions, including diabetes, heart disease, stroke, and some types of cancer. In this national map of adult obesity, we see that the deep red states have the highest rates of obesity among adults, with about greater than 35% of the population having a body mass index of 30 or above. Colorado and Washington, D.C., which are colored in light green, have the lowest rates of obesity. And the prevalence of obesity among adults in Delaware is about 34%, which puts it in the middle range with a lighter orange color. In addition to the high prevalence of obesity, there are important racial ethnic disparities in obesity among adults in the U.S. and Delaware. In the U.S., the prevalence of obesity is higher among Blacks and Hispanic/Latinx populations relative to white individuals. However, we see in this table that this inequity in obesity is actually smaller among Delaware residents than in the U.S. as a whole. Physical inactivity and unhealthy diet are also important influences on obesity risk. And we know that there's a high prevalence of inactivity and having an unhealthy diet in both the U.S. and in Delaware. As with obesity, there are important differences in physical activity and healthy diet by race ethnicity. In addition, social determinants play an influential role in the opportunities people have for healthy eating and being physically active. On average, the population in the U.S. does not get enough physical activity, which is the PA in piano, as it's shaded in the title. The CDC recommends 150 minutes of aerobic exercise every week for adults. And recent data show that only about a half of all Americans get that much exercise. And in Delaware, less than half of all residents get that much exercise. And just over a quarter of Delaware residents report that they haven't participated in physical activity in the last month. Like with obesity rates, we also observe racial ethnic disparities in physical activity among Delaware residents. According to the CDC data, about 44% of white Delaware residents report that they did not participate in recommended amount of physical activity, while 58% of Black adults and 56% of Hispanic or Latinx adults reported the same thing. Now let's look at food security and nutrition in the state, with nutrition being the N in P&O. The USDA defines food insecurity as having limited access to nutritious food, and this limitation may be due to lack of money or other resources, such as transportation to easily obtain food. In Delaware, prior to the COVID-19 pandemic, we know that about 10% of households were likely to be food insecure. And during COVID-19, it's estimated that there are about 50,000 more food insecure individuals in the state. As with obesity and physical activity, we also know that there are racial ethnic disparities in access to healthy foods. For example, the USDA and CDC recommend 5 servings of fruit and vegetables per day. And we see that many Delaware residents do not meet that recommendation and eat less than 1 vegetable per day. This includes almost 40% of Hispanic or Latinx adults, 20% of Black adults, relative to 17% of white residents who are not consuming at least 1 vegetable each day. So turning back to COVID-19, we know that the pandemic has had a detrimental impact on vulnerable populations. Specifically, it has impacted many of the factors that we consider social determinants of health. It has led to instability in food access, economic resources, and housing among large swaths of the population, and this has decreased access to healthy food, housing, and other material resources. COVID has also made it difficult to participate in physical activity, both due to restrictions on access to facilities and parts, but also through economic conditions that make it even more difficult to find time or opportunities to be active. And this has all compounded the health burden caused by COVID-19, as part of the puzzle explains how COVID has exacerbated social inequalities in health. So one factor that the COVID-19 pandemic has impacted is food security and hunger. This slide depicts food security before and during the pandemic. While food insecurity was high previously, it has grown substantially during the pandemic. For all racial ethnic groups, at least 25% more households were food insecure during COVID-19 than the year before. And as this figure shows, racial ethnic disparities that existed before have persisted during the pandemic. We know that certain segments of the population have experienced greater economic hardship and instability during the COVID-19 pandemic. This table presents Census Pulse Survey data from February 2021. As you can see, 47% of adults reported the loss of some household employment income. However, the loss of income falls disproportionately to Blacks, Hispanics, and Asians relative to whites. Similarly, the pandemic has caused a high degree of housing stability for families. Economic instability makes it more likely for people to have trouble paying rent, which can lead to eviction, and that is especially perilous during the pandemic. Recent data suggests that between 28,000 and 40,000 households are at risk of eviction in Delaware, and between 26 and 40% of renting households are at risk. These data also vary by race ethnicity, with about 13% of Black and Hispanic adults reporting no confidence in their ability to make next month's housing payment compared to 5% of white adults. And the impact of social determinants has played out in the incidence of COVID-19 in the US and Delaware, with racial ethnic minority populations being disproportionately impacted by COVID-19. In this slide, we see the percentage of the population in the US in each racial ethnic group and the percentage of COVID cases that were experienced by that group. Among Hispanic, Latinx, and Black adults, the percentage of cases experienced by these groups is disproportionately higher, which is in light blue, than the percentage of the population represented by this group, which is in dark blue. And this reflects a key health inequity. This pattern is the opposite among white and Asian populations. This trend is true in Delaware as well, with white individuals representing 62% of the population and only half of COVID cases. However, when we put these figures together, you'll note that these inequities are larger in the US as a whole than they are in the state of Delaware. Although this isn't true for Hispanic or Latinx populations, where the inequity is a little larger in Delaware than in the US as a whole. In this slide, we present a model from 14 years ago that foreshadowed how health disparities could contribute to unequal outcomes in illness and death for a flu pandemic. And this reflects the kinds of patterns we've seen during the COVID pandemic. In this model, we see how lower socioeconomic position based on income or occupation can lead to a difference in workplace exposure to COVID, with working from home not being a feasible option for essential employees, including many low-wage workers. Similarly, crowded housing conditions might contribute to increased risk of exposure to COVID. And differences in susceptibility due to underlying conditions, such as diabetes, nutritional status, obesity, or overweight, might lead to poor outcomes or unequal levels of illness and death. So with that context, we want to turn now to what PANO is doing to address obesity in Delaware through its Advancing Healthy Lifestyles initiative. As we described earlier, PANO's mission is to support strategies for government, media, communities, healthcare providers, schools, and work sites to decrease overweight and obesity in Delaware. Building on this mission, the Advancing Healthy Lifestyles initiative is taking a health equity approach to address physical activity, nutrition, and obesity throughout Delaware. So what is the goal of the Advancing Healthy Lifestyle initiative? Through this initiative, PANO is trying to promote healthy lifestyles and improve health outcomes for all Delawareans by doing a couple of things. By building a transformed society that promotes healthy lifestyles now and beyond the current health crisis, and by meeting the needs of Delaware populations across the life course. The Advancing Healthy Lifestyles initiative represents an equity-driven approach to health programming in the context of COVID-19. The goal of Advancing Healthy Lifestyles initiative is to improve health and prevent chronic diseases for all Delawareans while considering the impacts of COVID-19 across the state. And the Advancing Healthy Lifestyles programming is targeted, equitable, and sustainable. The pillars of the Advancing Healthy Lifestyle initiative support policy, systems, and environmental change. This includes supporting wellness initiatives in schools, community settings, and in the workplace. The Advancing Healthy Lifestyle strategy involves multiple strategies that are reflected in this figure. These strategies will be implemented during COVID-19 and as we transition to a post-COVID environment. The strategies include promoting changes in policy, systems, and environments, influencing the structures in which we work, live, and play. An emphasis on advancing health equity and meeting the needs of populations disproportionately affected by COVID-19. Supporting cross-sector collaboration with a wide range of state offices, community partners, and stakeholders. And the use of innovative, evidence-based interventions that have shown to have an impact on population health outcomes related to obesity and chronic disease. So delving into these components, the first prong of the initiative is policy, systems, and environmental change. A big focus of advancing healthy lifestyles involve changes that go beyond programming and into systems that create the structures in which we work, live, and play. This includes policy changes at the legislative or organizational level, systems changes made to the rules within an organization, and environmental changes made to the physical, social, and economic conditions in which people reside. The second prong is focused on advancing health equity. As we presented in this webinar, COVID has highlighted inequities in health throughout our society and the state. The same factors that have led to inequities in COVID-related illness and economic burden also shape our behaviors and opportunities for healthy lifestyles. The Advancing Healthy Lifestyles Initiative reflects DPH's vision towards a health equity for all Delawareans, where everyone will achieve their full potential. In doing so, it emphasizes the importance of attaining the highest level of health for all people, and it draws attention to the importance of access to and quality of resources needed for health. Another key strategy of advancing healthy lifestyles is facilitating cross-sector collaboration across diverse sectors, including healthcare, work sites, and educational and community institutions. This work will involve teaming between public and private partners. This will build on the foundation of the previous work in the state. And a specific approach to advancing healthy lifestyles we'll use is action teams and learning collaboratives that will allow organizations to plan and implement projects using a joint planning approach. Finally, the Advancing Healthy Lifestyles Initiative is building on a foundation of evidence that has demonstrated effectiveness in promoting healthy lifestyles and improving community health through the use of dynamic and innovative evidence-based models. This includes two things: frameworks and tools that use and leverage evidence-based strategies, such as the use of action teams and learning collaboratives, and involves the implementation of models that have been evaluated and shown to be effective in school, community, and worksite settings. And these models include interventions that were recommended by the Healthy Lifestyles Subcommittee. Work under the Advancing Healthy Lifestyles Initiative will tailor these evidence-based models to the initiative's priority settings, or pillars. So the strategies we just described will be applied across the 4 settings, or what we call pillars, within the Advancing Healthy Lifestyles Initiative. The planning pillar is cross-cutting. It involves the development of an action plan based on engagement with key stakeholders, as well as education and the strengthening of community partnerships. The 3 other pillars, schools, communities, and workplaces, are the specific settings in which these strategies will be applied. In the next section, I'll provide an overview of the planning, school, and community pillars, and then I'll describe the nature of the work that's underway in the workplace pillar. The planning pillar will involve the development of an action plan for implementing recommendations put forth by the Healthy Lifestyles Subcommittee. This will be done by engaging with stakeholders, using an equity-focused approach that reaches out to individuals representing communities with the greatest needs. And as part of the planning pillar, there will also be a 5-year strategic plan produced for PNO. The coordinated school health and wellness pillar will focus on providing comprehensive physical activity, nutrition, and obesity prevention in schools. The strategies of this pillar will be to convene education stakeholders, prioritize schools with the greatest needs, and then beginning in summer to fall 2021, supporting school health action teams through a mini-grant process. The mini-grant will be used to support projects in schools focused on physical activity and healthy eating, with considerations to the effects of COVID on schools. Furthermore, Mathematica's partner on this project, Concept Systems Incorporated, will provide technical assistance to the Healthy School Action Teams to support implementation and reporting. Based on these strategies, the School Health and Wellness pillar will try to move the dial on such outcomes as healthy eating and healthy beverage consumption, food service guidelines and nutrition standards in schools, physical education and activity in early care and education, and the implementation of population and health and wellness programs in schools. The community capacity building pillar will focus on working with a few community partners to develop programming that supports physical activity, nutrition, and obesity prevention in community settings. My company, Mathematica, will be working with these partners to develop an action plan and plan ahead for their evaluation. Some key strategies that these partners are using are developing a program for the Asthma-Friendly Schools Initiative and implementing a healthy retail project that improves access to healthy food among communities with high needs. The key outcomes of these pillars are population, health, and wellness programs in schools, school protocols to meet the needs of students with chronic conditions, and healthy eating and healthy beverage consumption. Now, we'll look a little more closely at the work Advancing Healthy Lifestyles is doing related to worksite and employee wellness. The focus of the Worksite and Employee Wellness pillar is to expand marketing and promotion of worksite wellness initiatives and to develop a plan to influence the culture and policies of workplaces to support employees' health and wellness. This will be done using such strategies as developing a formal workplace wellness infrastructure for state employees, creating infrastructure for non-state employees to adopt workplace wellness programs, and strengthening breastfeeding supports in the workplace. And in the next slide, we describe how these workplace wellness strategies will be implemented. The desired outcomes of this work are improvements in healthy eating and healthy beverage consumption across all settings, increased physical activity in worksites, improved health and wellness programs and platforms in worksites, and greater access to breastfeeding-friendly environments. During this launch of the Advancing Healthy Lifestyles initiative, Mathematica has worked intensively with the state on the first key strategy within this pillar, which is to support the development of a workplace wellness policy for state employees. For this part of the work, we've collaborated with PANO and the Statewide Benefits Office in the Department of Human Resources to create and facilitate a work group to review a draft of a workplace wellness policy. In addition to getting feedback on this draft, this work has involved reviewing evidence on best practices from other states that have implemented workplace wellness policies, and developing measures of progress for the implementation of the workplace wellness policy will be part of this work as well. So as a part of this work on the worksite employee wellness pillar, our next steps will be to continue this work to advance a workplace wellness policy for state employees. This will include soliciting feedback from the work group of human resources staff and other key stakeholders on a draft of the workplace wellness policy for state employees. The work will identify ways to expand the policy to address additional public health priorities. And ultimately, this group will plan for the implementation of this workplace wellness policy for state employees. In addition, PANO's work will continue expanding the marketing and promotion of worksite wellness initiatives. This will include developing a plan for influencing policy and culture that support employee health throughout the state, and may in the future involve working with their organizations to support employees' health and wellness. So that brings the main section of the webinar to a close. Now we'll turn to Pano for the last word on the Advancing Healthy Lifestyles Initiative. Shebra, can I pass it to you now?
Sure. Thank you so much, Dan and Rachel, our friends at Mathematica, for leading this webinar today. I'd like to thank the participants, everyone, for joining us today. I'm really excited. There was so much interest and enthusiasm around the Advancing Healthy Lifestyles, Chronic Disease, Health Equity, and COVID-19 Initiative, or AHL for short. Again, thank you, Mathematica, for helping us lead this work, along with Concept Systems, Inc., particularly around the first pillar that you mentioned, Dan, planning. So as you mentioned, we will be really focusing on providing a strategic plan for PANO in the upcoming years. We have been looking for some input and outreach, and have been had some outreach to our key stakeholders throughout the state through a survey process on the Healthy Lifestyle Subcommittee policy recommendations that were submitted to the governor earlier this year. So we will continue to engage our partners throughout the state in that process. I just wanted to add that we will be inviting folks to join us for World Cafes. These World Cafes will be an opportunity to really dive deeper into the policy recommendations, prioritizing and implementing those recommendations. I also wanted to add what's here on this slide regarding the Advancing Healthy Lifestyles Learning Series. So these learning series will be an opportunity for organizations that perhaps have not been directly involved with the Advancing Healthy Lifestyles work thus far. The resources and information that we will look at, these topics that we will go over in the learning series, I think will be really exciting and great opportunities for advancing some of the work that our community partners are doing. Some of the topics are culture of health, promoting equity for health now, valuing voice and health promotion, and evaluation practices that fit. And those will all be just in the next couple of weeks. So that's really exciting, and so look for invitations for those learning series opportunities. And we hope to continue to plan those throughout the year. I think that's it. So thank you, Mathematica, for leading this webinar. And as you said earlier, it is recorded, so we can share this later, and hopefully all the participants will share it with their colleagues as well. So thank you.
Great, thanks, Shebra. I guess with that, we'll open it up to any questions that folks have. You can either enter it in the chat box, or Derek, at this point, if we need to, we could also open the lines for folks to ask questions.
Thanks, Dan. I noticed that there are no questions yet in the chat box, so please feel free to type in a question if you have any, and we will do our best to answer them.
Well, I can just add that for folks maybe listening in later, if there are questions or things that pop up that you are interested in, please feel free to reach out to me, shebra.hall@delaware.gov, and I'd be happy to engage you that way and answer any questions that you might have.
So thanks, Shebra. We actually got a question from Irene Susi, and she wants to know if there's a timeline planned or if this is going to follow the development of the strategic plan.
a timeline planned for the workplace draft?
So the question doesn't, yes, actually.
Okay.
She just followed up.
Okay, so I don't know, Dan, if you want to jump in as well, but we are working with a workplace wellness work group, which is made up of folks from around the state who work in human resources and who will be able to add to the current draft that the Statewide Benefits Office has provided. A great starting point for us. Mathematica is helping us with advancing that policy, getting feedback from all the folks in the work group, as well as looking at models from the CDC scorecard, as well as what other states are doing as they've implemented workplace wellness policies across the country. So we're not trying to rush this work, so we have started it. I think it's not something that's going to happen overnight, but hopefully over the next several weeks of meeting, we'll come up with a draft, and we will continue that work with hearing from other states and exploring other evidence-based strategies and models. So, Dan, if you wanted to add anything, that would be great.
No, I think that you summarized it really well, Shebra. And just to say that work is underway now. The work group is meeting and meeting a few times between now and the end of this fiscal year, and we'll continue into next fiscal year. But we have a really diverse representation of folks working in state agencies and giving some really great input on what's currently in the draft of the workplace wellness policy and ways to expand it. And it should serve as a really great model for employers who are also able to do this kind of thing.
Thanks, Dan. So we have another question, and you've indirectly touched on it, but I will read it out loud. So is the purpose of this webinar to just introduce each area of work, and are there focused webinars in the future planned to dive deeper into each of the areas, such as workplace wellness strategies?
Well, today's webinar was to focus more on the workplace wellness and to get feedback and questions from those interested in that pillar, the workplace wellness pillar. And as we said, that the workplace wellness work group, it's a lot of W's, sorry, is working on this, and we will be getting feedback. We don't have any webinars planned to dive deeper into the workplace wellness policy strategies, but we are going to be seeking your input and feedback as we move forward with drafting the policy. We have another webinar scheduled for community-based capacity building initiative or pillar of the Advancing Healthy Lifestyles initiative, so we will be looking at covering pretty much the same thing that we talked about today, but with more of a focus on the community-based, the community capacity building pillar. So these webinars are really just to introduce the initiative, Advancing Healthy Lifestyles, and to give the opportunity to address each of the pillars separately. So today's webinar was for the workplace wellness pillar.
Thank you, Shebra. So there are no other questions in the chat box. We could wait one more minute to see if anyone has anything else.
I think that probably seems like a good time to wrap if folks don't have any other questions.
I'm sorry, Dan. You know what? We did get one last question in.
Oh, excellent.
Okay. Is there a list of those who already connected to the work group so that we don't duplicate time on a work group if other coworkers are already representing?
So the Workplace Wellness group, we do have a group of individuals who are participating currently in that work group, and there may be some department duplication. There's several divisions or agencies within a department, but there is no duplication. These individuals were selected, I could say, to participate. But as I said, we will seek opportunities, or there will be opportunities for feedback from others. But I don't think there will be any duplication of different folks from the same division or agencies.
And as a follow-up to that question, Shebra, the writer wants to know if that includes outside agencies, not just the Department of Public Health.
So right now, the Workplace Wellness Work Group is just looking at developing a framework for a policy that would just impact executive level state agencies, so executive branch state employers. We're hoping that with this kind of framework and template could be a model for employers throughout the state, so non-state entities as well. We do have representation from, as I said, executive branch state employers, so that's all the departments, but also the Delaware National Guard, that's also our school system. So we are hoping that this policy can be a model for other employers, but we need to start somewhere, and it seemed the best to start with what we could control a little bit better and get some buy-in from the state as the largest employer in the state. I don't know if you wanted to add anything, Dan or Rachel.
I don't have anything to add. Dan? Oh, you're muted, Dan.
Oh, sorry. Thank you. I think that's great. I think hearing Shebra's perspective on how different folks can get involved and how this is being organized is really valuable.
I will also add that the Advancing Healthy Lifestyles Initiative will have its own platform at some point on the healthydelaware.org website. So this page will have meeting information. It will host these webinars as well, or have these webinar links as well. So again, this will be an opportunity for folks who are not directly involved or directly participating to be able to listen or read minutes or meeting summaries. If there's resources shared, for example, resources from other states, templates and models from other states. So those documents, those materials will be available on the website, and I will be sure to share that information as soon as possible.
And Shebra, would you say, if folks have other questions after today's webinar, what's the best way to follow up? Would it be?
Sure. Yeah, folks can email me directly. So shebra.hall@delaware.gov. That's shebra.hall@delaware.gov. And again, the information will be on the healthydelaware.org website very soon, so stay tuned. I will also send out communications from either myself directly or Mathematica. Will be sharing information, these webinar links, so the information will be out there. It will be accessible as soon as possible.
Thanks, Shebra. We don't have any other questions, so I think we can probably wrap it up.
Okay, great. Well, I guess I'll just, Shebra, unless you have anything to add, I can just close it out and just thank everyone for joining us for a webinar on a Friday afternoon. We really appreciate it, and we're really excited about launching this work. And you'll be hearing more from Pano and from all of our members of the team about the work going forward. If you have any other questions, you should feel free to submit them to Shebra, and we really look forward to working with you all in the future. And thanks again for joining us today. All right. Have a great day. Take care, everyone.